Dr. Hoyos.
Hello, Dr. Rod. How are you doing?
It's great. Well, it's great to have you with us for PRS, and it's a real honor and pleasure. And congratulations on your wonderful article that is coming out in PRS. So we're very pleased to have it. And of course, as you know, it's called Male Aesthetics in the Gluteal Area, and how you really are transforming that whole area. So what has been the goal in your study that's going to help males understand and the consumer about how that's transformed in the male?
I think it's very important because we always concentrated our efforts aesthetically and I think in terms of pleasing the patient in the female form.
Right.
Yeah? And in some sense, the heterosexual male was not very aware of that area. You know, I always say that when you see a man that wants to have it done, it's because they're coming with the wife by the hand and the wife
Right.
is doing the talking. You know, they don't talk at all, you know.
Right.
When you ask them, okay, you want to do anything done in the buttock area? And they say no, and the wife says yes. And they, of course, they end up doing what the wife says, you know.
Of course, like everything else.
Yeah, like everything else in life, yeah. But I think the main idea is that men want to get apart from the aesthetics of female, you know, and
Right.
they didn't know to put it in words, you know, they didn't know how to put it in something that is very specific, but we can because we
Yeah, and
actually
plastic
have
surgeons
aesthetic.
haven't in the past either, as you know.
Yeah. So there was nothing written, you know, when I was doing the revision for writing this article, we could see the lack of the articles about masculine features that were aesthetically pleasing, but at the same time, something that looks more athletic, because at the end, that's what we want in men.
Yeah,
That
so
the
what
buttock area
did you
looks more
find?
aesthetic.
So what did you find, Alfredo? I mean, this is fascinating.
It's very different than in female, you know. In female, what we want is something that looks more smooth, something that actually has the curves, the S curves, more feminine, more subtle. In men, we want hard edges, you know, and specifically, we want the muscles to show. Specifically the gluteus maximus, but also the gluteus medius. And I think
These are these big buttock muscles. Yeah, buttock muscles.
And I think the key feature here is the gluteus medius, because he's the one that sets the difference between male and female. You know, masculine is the gluteus medius in a heart shape, in a more adequate shape and form, and also the mass of the muscle is important. On the other side, we have the trochanteric depression. The trochanteric depression in female is something that we don't want to see because it looks like the form actually makes the shape not as feminine as we want.
Right.
In men, we want it to show. We want the depression to be shown, and actually that's the key for making it look more athletic.
Right, that's great. So what do you tell the consumer if a male is looking at this video and he's saying, well, what should I ask my plastic surgeon from, you know, you as the expert, Dr. Hoyos, in 3D sculpting? What should they ask their plastic surgeon that they desire? Like the three top things. They want that hollowing of the outer buttock area. They want, what else?
They want the muscles to show. They want the trochanteric depression to be shown. But specifically, they want to be very different to the Kardashian kind of type, you know, because every time that you mention to a male patient a buttock fat grafting, they say, no, I don't want it. But they don't know what they don't want. You know, you have to show them.
Exactly.
I think the first thing is to guide the patient, to tell them, okay, it's not the thing that we do in female. You're not gonna look like Kardashian.
Right.
It's going to look more muscular. It's going to look toned with the rest of the body. That the idea is to make it look more athletic.
Right.
And it's going to look masculine. You know.
Masculine. That's excellent. So I think the most important take home also is make sure you find a true plastic surgeon that's an expert in 3D sculpting more than anything else. I mean, obviously board certified in their country, and obviously someone that has learned from a master. Like you is also important. And of course, you know, make sure you read the #1 journal in plastic surgery at prsjournal.com. And it's been a true pleasure having you with us today. And we look forward to reading all of your upcoming articles as well. And this truly has been an epiphany article for males that are seeking a board certified plastic surgeon, but now they know what to ask for. Thank you so much.
Thank you very much for having me.
It's my pleasure.